Hello all my cosmetic friends out there. I've got an interesting post for you today on how you can actually have Botox to your crow's feet and not look weird. It's a common issue I see with a lot of people who've had Botox. Often I walk down the street or see people who've had Botox to their crow's feet and I can tell straight away that they've had Botox and it doesn't look natural. And the problem with this is it doesn't improve your attractiveness. So if it doesn't do that, then it's not a good treatment. If it's noticeable and it doesn't make you look better. Sure, it can get rid of wrinkles, but if it's not done properly, then you might as well not have it done. It's better to go just natural rather than have it done poorly. Crow's feet are a very common concern when people smile. They don't like the lines that radiate from the corner of the eye outwards. Botox can be used to treat and relax the orbicularis oculi muscle, which is the muscle which contracts like a sphincter and gives you radial lines out from the corner of the eye. Now, just of note, you can't really treat under eye wrinkles with Botox. That tends to be more of an issue of skin laxity, but certainly you can treat easily the crow's feet with Botox when you smile. You've got to understand also that crow's feet are a positive expression, so it's okay to have a few crow's feet. Young people have crow's feet and they don't look bad. It's something that you might want to moderate or reduce, but certainly it's not something you want to get rid of. Crow's feet or smile lines are really a positive expression. When we smile, we get contraction of that muscle. So unlike, say, for example, the frown, which is, there's no real positivity to frown. When you're frowning, you're frowning. So what is the issue, firstly, with having Botox around the eyes? As I said, I see it all the time, poorly done. And the main reason for it being poorly done is it doesn't balance with the rest of the face, and especially it doesn't balance with the under eye area. So the first thing is setting the right expectations for the patient. I mean, most patients will come in and want to completely obliterate any sign of crow's feet, and that's usually a mistake. So it's important for the doctor to advise that getting rid of crow's feet altogether is not necessarily a good thing. It's important to leave some crow's feet and to have some normal contraction. We just don't want them to be as extensive. We just want to moderate them a bit. So it's important to get a moderate dose of Botox around the crow's feet. If you put too much in, it literally holds this bit open like this, and you get a very sort of wrinkleless look through here, and it looks odd. When you smile, it doesn't contract naturally. So when you smile, there are two main muscles which lead to the formation of crow's feet. Now, firstly, it's the zygomaticus muscle, which goes from the corner of your mouth up through here and pulls upwards, elevates the cheek and pulls the corner of the mouth up. Now, we can't Botox this one because if we did, we'd look like we have a stroke. So this muscle, it will contribute to the smile lines of crow's feet, but we can't treat it. The muscle we treat is the orbicularis oculi muscle. So if, for example, you over-treat this area here, the whole animation of that area changes. The zygomaticus muscle continues to pull up, but the orbicularis muscle, which is being treated with Botox, is frozen. So you get this elevation of the cheek and freezing of this area here. So it looks like that this area is frozen, yet this part still moves, and the whole animation is incorrect. It just looks weird. The next thing is the placement. The placement of where to put Botox around the eyes is really important, and too often I see incorrect placement of Botox around the eyes, which again leads to a very unnatural appearance. There's probably two main issues I see. Firstly is putting Botox too close to the eye, so too close to the orbital rim or the eye socket. The problem with this is you're cutting the contraction of the wrinkles very short. So you're making the wrinkles very, very short, and in some cases, if it's close enough, there's no wrinkle at all. So basically the wrinkles don't extend out at all. So I think it's important to actually place the Botox a little bit further out, so you do contract a little bit and show a short crow's feet, but you don't want it to extend all the way down. So keeping the Botox further away from the orbital rim or the eye is important, not too close. Too close means you're going to have virtually no crow's feet, which looks, again, very unusual. You must have crow's feet. It's actually important to have a little bit, but you just don't want the lines to keep going out. That's what Botox can do by being placed a little bit further out. Another huge issue I see with Botox, and it's a dead giveaway, just to make a point in here, is that if someone can tell you've had Botox, it's not good Botox. So Botox should be done in such a way it cannot be detected, and that is the best treatment. In fact, that's the best with all cosmetic treatments. You don't want to be known for having cosmetic treatments unless you tell people. I mean, if you tell people, that's fine, but you don't want someone to look at you and notice that you've had something done. That's a bad treatment, basically. The other problem I see is Botox being put right here in the corner, the bottom corner of the eye, either too big a dose in that area or placement which is too close to the eye. Now this muscle, the orbicularis, at this point causes elevation of the cheek. So when you smile, this bit elevates. Now if we over Botox this point here, or put it too close up to the eye there, what happens is this bit is held down when you smile. So the orbicularis oculi muscle at that point can no longer elevate the cheek. Normally it does. See, my cheek goes up, and that's partly because of the orbicularis oculi muscle here at this point. So over Botoxing this point here often leads to what I call ledging. That's a term I just made up myself. But the reason being, it causes what looks like to be a ledge. So this flattens down, this lifts up, and you get like a shelf or ledge there. So that looks awful. And again, a dead giveaway that you've had Botox. Unfortunately, one of the areas which patients often complain about are wrinkles in that spot. So I think, again, setting patient expectations is very important, and they have to understand they have to have a little bit of natural movement and wrinkling there. Otherwise, it will look weird. In summary, Botox for the eyes is a very difficult area to do. It has to be done with a lot of care, the right dose, the right placement, so that you don't look weird and so that it doesn't look like you've had Botox, but it just looks like you're refreshed, and it just helps to stop the overextension of crow's feet into the cheek. Alright, I hope you've enjoyed that video and look forward to talking to you again next time.